Welcome to this segment of our learning series on Health Equity Basics. This program is brought to you by our regional chronic disease collaborative partners in Alaska, Hawaii, Montana, and Wyoming. This segment will cover the factors, both medical and non-medical, that help determine our health. The opportunity for health begins in our families, neighborhoods, schools, and jobs. Our opportunity for health starts long before you need medical care. The categories represented on this slide have been identified as contributing to a person's health. This data from Healthy People 2030 shows that 16% of what determines someone's health is the clinical care they receive. The remaining categories make up 84% of your health status and are non-medical factors. Social determinants of health are the non-medical factors that influence our health. They are conditions in which we are born, grow, work, live, and age, and the wider set of forces and systems shaping our daily life, including economic policies and systems, development agendas, social norms, social policies, and political systems. There are 5 domains of social determinants of health identified by the U.S. Department of Health and Human Services. Each of them can contribute to the health and well-being of a person or community. The 5 domains are economic stability, education quality and access and quality of healthcare, neighborhood and built environment, and social and community context. People with steady employment are less likely to live in poverty and more likely to be healthy. Having difficulty finding a job, being limited in how much you can work, or not earning enough to afford the things you need to stay healthy can lead to disparities. These are some of the factors included in the economic stability domain. People with access to quality education and who obtain higher levels of education are more likely to be healthier and live longer. The healthcare access and quality domain addresses things like barriers to accessing healthcare, lack or low insurance coverage, and even not having an assigned primary care provider that can provide preventative services and help coordinate your care. The neighborhood and built environment domain includes safety, unsafe air or water, or lack of internet or broadband services. The social and community context domain includes people's relationships and interactions with family, friends, co-workers, and community members. Positive relationships can help reduce the negative impacts of facing the challenges and dangers of uncontrollable factors like unsafe neighborhoods, discrimination, or trouble affording the things we need. The term health-related social needs is sometimes used interchangeably with social determinants of health, but an important distinction can be made. Health-related social needs refers to the social and economic needs that individuals experience and that affect their ability to maintain their health and well-being. Health-related social needs are a result of our community's underlying social determinants of health. Advancing health equity means addressing the health-related social needs that are the result of social determinants of health, as well as working to eliminate their root causes. The next segment will cover the idea of how both upstream and downstream interventions play a role in health and health equity.